So excited for the next presentations and the discussion. I'm pleased to introduce Dr. Christina Roberto, Assistant Professor of Medical Ethics and Health Policy at the Perelman School of Medicine at University of Pennsylvania. She's a psychologist and epidemiologist and is principal investigator of the Psychology of Eating and Consumer Health Lab.
Great. Thank you. I'm delighted to be here. I'm going to talk to you today about an approach to research my colleagues and I call strategic science. So a lot of this talk is based on a paper that I co-authored actually with my graduate school mentor, Kelly Brownell. And he really trained me in the approach of strategic science. And I was one of his first graduate students to really go full on into it and carry out this kind of work. So we wrote this paper as part of a series on obesity in The Lancet. And it's a model that we've been trying to think about and apply to obesity, where we really need a lot of policy action. But I think it can apply to lots of other different kinds of problems. So we're here, we've got this aspiration of evidence-based policymaking, and I want to talk about how strategic science, I think, can help get us there. When I say strategic science, the goal I'm talking about is trying to address gaps in knowledge that are important to policy decisions. And I think there's a few barriers for why that's hard to do. So first of all, researchers typically are not trained to create policy impact with their work. Second, engagement with policymakers is infrequently encouraged or rewarded within academia. And communication of science tends to stay largely within science. Now, some of that is changing. There's certainly more dissemination of research through the media. Some scientists are kind of taking control of this on their own through social media and tweeting about their research. And of course, there are going to be exceptions, and there are examples of people who do get their work to policymakers. But I think it's more the exception than the rule. So part of what strategic science emphasizes is this need for a two-way bridge. So we're doing better about getting our research out there, but that tends to ignore the flow from the policy world into research settings. The hope is that you have these conversations with people who are actually in positions to influence policy so that you can ensure your research is addressing policy relevant questions, and having that relationship up front obviously makes it a lot easier to communicate your work back to people who can do something with it. So a couple of steps I want to outline for strategic science. First, identify change agents. So what do I mean by that? So these are people who are in positions to actually influence policy and influence change. And they can come in a variety of different forms, right? So it could be legislators in Washington, it could be an attorney general, be regulators at the FDA, an advocacy group, or other important organizations that clearly have influence. Two, the goal here is, when you can, develop strategic questions together. So you're co-creating those research questions and learning from each other. Then, of course, as a researcher, I go off and I conduct on my own my rigorous scholarship, and I seek to get that published. But the last piece is obviously communicating the work back. So certainly we want to communicate our work through academic publications, which we always do, but also in policy-relevant forms. Sometimes that form is a conversation with a policymaker. Sometimes it's policy briefs, short summaries that policymakers can make sense of, opinions or editorials. That tends to have less emphasis in training. So just to outline and summarize here, first step, identify change agents, co-create those strategic questions together, go off and conduct rigorous scholarship that we need, and then an emphasis on really communicating it, which is a lot easier to do when you have that relationship initially. I think this approach, strategic science, can complement traditional programmatic types of science. So I actually do work that looks more programmatic, sort of your traditional building very incrementally. And I don't think these are mutually exclusive. I also think you can generate theoretical insights through some of this work. So I don't think it's an either or. A researcher has to identify one way or the other. And I'm going to give 3 very quick examples of how this has evolved in my career and sort of how I've learned about this and applied this approach. So the first quick story I'll tell is about a policy called menu labeling, which is putting calorie labels on restaurant menus. And what's been happening a lot in the world of obesity is there is some movement now to want to do something about it, and certain policies are getting introduced. There's not necessarily a lot of data behind these policies to know how they're going to work, whether they're a good idea, are there better ways to design them. And so when this happened, I was at the Rudd Center for Food Policy and Obesity at the time. It was based at Yale. And this policy idea comes up, and I'm looking in the literature, and there's not a lot on it. And we thought, this is happening in New York City right now. This is moving forward, but there are a couple of lawsuits, so it's suspended. We don't know what's going to happen. And we do have some time to get some research done relatively quickly that could still be rigorous to inform this debate. So what we did was we actually brought 300 adults in from the New Haven community, and we mocked up a little restaurant lab, because it was hard to actually do this in the field, and the policy had not actually been implemented, so we couldn't do any kind of pre-post evaluation. So people come into our restaurant lab, and we could randomize them to one of three menus: a menu with calorie labels, a menu without calorie labels. And then we thought, well, maybe we should have a third condition where we put that calorie information in context. And we have a statement on the menu that says the recommended daily caloric intake for an adult is 2,000 calories. And that might maximize the benefits of this policy if it works at all. And so people came in, they ate dinner with us, we did takeout from restaurants, they didn't know we were doing this, but we weighed all their food. We then had them come back the next day, and they didn't know why, but we asked them to tell us everything they ate later that night. So they had dinner with us, and then tell us what you ate later that night. And I'll just show you some quick results. There we go. Okay, so we get this data back, this policy story is happening in New York, and we're like, okay, let's see, is this even a good idea? So we look at the calories people actually ate in this study. So in the no calorie labels group, they're eating about 1,450 calories. When labels were on there, they were having fewer, and then when labels with the contextual statement were on there, they were also having fewer calories. So some evidence that maybe this idea could push people to eat fewer calories. But remember, we had this piece of what they ate later that night. So in the no calories condition, they go home and they have about 170 calories. When calories labels are on the menu, they go home and they eat more, because they're humans. That's what we do, right? So they compensate and it wipes out the effect. But when that contextual statement was on there, it seemed to prevent that overeating from happening later. So when we wanted to draw conclusions about this study and we looked at no calories versus calories, we didn't see much of a difference. Where we saw the difference was with this contextual statement, about 250 calorie difference on average. And so at this point, Kelly has this story where he's going down to testify in Washington about the policy. The data's hot off the press. To your point, it was under peer review, but he's drawing the data on napkins, showing different congresspeople who are writing this policy as we speak. They found this evidence compelling. And so in somewhat haphazard, not necessarily systematic way, this did end up getting communicated, and in part was the basis for including that contextual statement in national menu labeling policy, which is part of the Patient Protection and Affordable Care Act. Now, it's one very small insight, one very small part of the policy, but it was some data saying, look, we do think that this might be helpful, and there's another way that it might improve it. I'll give you another example. There was in front of packaged food labeling. At the time, this is several years ago now, a labeling system was introduced called Smart Choices. And it was a label that was going to go on thousands of food products. And the idea behind it was a good one. It basically wanted to alert consumers to products that are essentially better for you, or smart choices. And a bunch of people got convened to do this, so there were academics and industry folks and public health educators. And so the idea behind it, the principle behind it, was really good and seemed like a great idea. So this gets released, and I'll show you some of the products that it's on. Yikes, right? Cookie Crisp, Hellmann's Mayonnaise, Lucky Charms, perhaps not the smartest choice. So here's how this story evolves. The FDA sends a letter to the Smart Choices program saying, look, we're going to monitor this program. We're a little bit worried about some of the products that this label's on. There's some scathing media attention on this. New York Times is questioning, because on its surface, it doesn't seem like such a great idea. And then something very interesting happened. So we actually connected with the Attorney General at the time, who was in Connecticut. He went on to be a state senator, so Dick Blumenthal. And he cares about consumer protection and misleading consumers. And so, we're connected with him, and we thought, look, it could be that just a few products aren't that great, or we could do a very quick systematic analysis to see how bad, so to speak, this program is. And so we call this a kind of quick strike study, where the Smart Choices website is up there. We can randomly sample foods from 8 different packaged food categories. We got 100 products. We looked at their nutrition information, and we applied an objective nutrition standard. It's called the nutrient profile model. It's been used in policy decisions in the UK. It's been validated with nutritionists. And the bottom line is, we found that 64% of those products wouldn't meet an objective nutrition standard. So that was something where we could then go back to the Attorney General and say, look, we've done this quick analysis. You have this feeling that it's not so great, and there's some data to support it's not so great. It's not just a couple of products. He then, goes off and speaks strongly against this. And actually, it was quite a public health victory. And it wasn't just one piece. There was this Attorney General, this public health champion. We had a little bit of data in there. There was the New York Times coverage, the FDA, and they actually halt the program, right, without litigation or legislation. And so I thought that was just sort of a nice tale of those forces coming together and stopping something that could be problematic for public health. And the last example that I'll end on in terms of case studies of this is something that I'm working on right now. So this is another example where there's interest in putting warning labels on sugary drinks. Bill's been introduced in New York, bill in California, San Francisco wants to put labels on the advertisements, and it would look something like this, essentially a warning label that would say, drinking beverages with added sugar contributes to obesity, diabetes, and tooth decay. We have no data on this, right? We don't really know how it would impact people. And so in my mind, this is a good opportunity for some data that could bear on this question as it's unfolding now. And so I certainly had a lot of ideas as a researcher and questions I wanted to run, but first I got connected with the California Center for Public Health Advocacy, who's been really instrumental in pulling this forward and helping write this bill. And so together we started crafting questions, because I went in there saying, well, I really want to study warning labels, and wouldn't it be cool? We could look at graphic labels and sugar, and I'm going to do that work. That's going to happen. I'm interested in those other questions. But they said, look, what we need right now is if you could test the text warning labels. That's what's politically feasible. If you can infuse some psychology into different variations of them, both of our goals get met. I thought, okay, that makes a lot of sense. So we started doing that work. And fortunately, they have a legal team. So we're testing different text warning labels in an online experiment. We're also ensuring that they're actually legally viable, right? So we're not going to find something that works that could never even happen. Then we also have a group of nutritionists, a scientific advisory board, who's ensuring we're testing labels that actually reflect the state of the science. And then my group is the behavioral scientists on the team to really think about the psychology of that label design. I can just tell you, I'm not going to present any results from this, but we've got 3 surveys in the field. It's what we could do in a reasonable amount of time with a somewhat limited budget to actually have a bearing on this, because the hearing in California is happening in December. So we've collected data actually with some promising effects of parents with a large study, over 2,500 parents. We have an adolescent survey in the field, and we're also going to run it with adults and try to figure out, in an online environment, is there any indication that this might prompt consumers to actually make different purchases, or at a minimum, just inform them about the sugar and sugary drinks and the potential health consequences? So, yeah. Sorry, there we go. So I'm going to wrap up. Those are 3 examples of how I've been applying this approach in my work. I'm just going to talk about the place I got trained at, where I learned how to do this, and what's unique that I think we can learn from and try to apply to other settings. And so it's the Rudd Center for Food Policy and Obesity. It was at Yale, and it's since moved to UConn. And I think there are a few features of the Rudd Center that are really incredible. So first of all, there's a focus on strategic science and doing this kind of work. Something very unique is that at the time I was there was private funding as well as government funding. And so we did have access to funds where we could do rapid response kinds of research. We didn't have to go through the long process of applying for a grant. We could be nimble in the questions we were asking because of that. It had an interdisciplinary team of researchers, which certainly lots of centers across the country have. I think one thing that was especially important is that center included legal experts. So sometimes I'd have a research idea and I'd march down to Jen Pomeranz and be like, Jen, I got this great idea. She's like, you know what, the First Amendment wouldn't let you do that. I was like, okay, I'm not gonna study that, right? So that was really valuable. And then they also had they have a full-time person who's dedicated to policy translation. There's an expert who has relationships with staffers, who makes the policy briefs, who makes those connections. Because, as a researcher, it's very hard for me to do the science and then worry about making an infographic and getting it out there. And finally, they had a whole communications team. So again, infrastructure that's dedicated to translating the work and making sure it has reach. So in terms of what's needed broadly, I think for our field, if we want to do this kind of work, you need infrastructure to support strategic science. I was in a very unique setting. I've now since graduated, I have a faculty job, and I'm not in a setting that's specifically geared towards this kind of work, so it's been more challenging. You need better means of communicating evidence in a timely way. And something that I really think would be important is more places and opportunities to actually convene relevant parties. We think about convening interdisciplinary academics, but it would be good to have places where policymakers and researchers can interact more. There's more obvious connections. I think also a huge challenge is incentives for scientists to do the work and communicate it. I'm a junior faculty member starting off on the tenure track. I'm certainly not incentivized to do the kinds of communication that would help translate this research. And I think more government and private funding for such work, especially when you're trying to do some of the rapid response stuff and you've got to be nimble and you've got to be able to get some data quickly. That data is not the be-all and end-all of the policy. You need those other evaluations later, but I think it's often helpful to have something in the interim. So I think one way to move towards this aspiration is with strategic science for policy impact. And I'll just leave you with my lab website if you're curious to learn more about this work. Thank you.